All right. Welcome
We ready?
back. Hi, Dr. Adeni. How are you doing this morning?
I'm doing great. Thank you, Allison.
You're our very first webinar, aside from the one that I just did. So, thank you so much for joining us this morning. You have been doing this event with us for a number of years. This is our first time going virtual, and you're always one of our greatest speakers because I feel like moms always have so many questions. We've already kind of gone through all of the information in terms of how to use the chat feature and the Q&A. Everyone is essentially supposed to kind of comment to be entered into the giveaways. So you're going to see some comments coming through. Dr. Adeni is the leading pediatrician at Baylor Scott and White in Lakeway. She's our pediatrician. All three of my kiddos see her. So it's always a joy to get to see her outside of the work setting and getting to do something fun with this event. But with all that being said, I am going to go ahead and give you the reins, and I will be here if you need me.
Thank you so much, Allison. So, good morning, everyone. Welcome to the Bloom event. I am Dr. Shubha Adeni. And first of all, before I forget, I want to thank Allison Mack and her team for inviting me to do this presentation. They put their heart and soul to organize this awesome event every year. Normally, this would be a wonderful live event held at the beautiful Lakeway Hospital. This year, for obvious reasons, we have to do this as a virtual event, but I am sure it will be a great one nonetheless. My goal is to hopefully address some concerns of pregnancy and childbirth during this pandemic and to alleviate some pressing worries. I will try to do that by giving you some facts without sugarcoating it. Now, I want you to know right off the bat that a lot of this applies to anyone that's pregnant, whether it is COVID pandemic or not. Next slide for me, Allison. So today's talk will be mainly focusing on what is involved in bringing a baby into this world during the current situation. The same things would apply even if there was no pandemic, but there are some extra steps to be taken and adjustments made to our new normal. I will discuss them as separate stages in this journey for you. My sources for today's presentation are the American Academy of Pediatrics and the CDC. I will go through them in this order. I will say a little bit about myself, and then we talk about pregnancy and delivery, then the postnatal period with baby, and then breastfeeding in the era of COVID-19, and then what to expect when you visit your pediatrician. And then last but not the least, I do want to touch upon the integrative approach to creating a healing space for yourself and your family. Next slide. So, a little bit about me. I have been on this pediatric career path for about 30 plus years. Children bring me joy, and I am passionate about caring for them and to get them ready for the world as stable, happy, healthy, and decent human beings. In doing that, I consider myself in partnership with parents and help them in their efforts to raise them. Personally, I have been blessed with a wonderful husband and three beautiful children who bring me joy every day. They are my teachers, and I learn from them every day, as I strongly believe that children have a lot to teach us only if we are willing to listen. Next slide, please. So here they are, my family, including my new little grand puppy. I call him Chance. We call him Chance. He really thinks he's a human baby and he wants to cuddle with us all the time. And we humans allow him to think that he's human baby also. So this family is everything to me. Next slide, please. Many of you are starting this beautiful journey into parenthood, and I want you to take a moment to think about this important decision. Your life will change for sure. when you become a parent. Being a parent is nothing like you have ever felt before. If you're already a parent, you know that what I'm talking about. It's not always a walk in the park. There will be some challenges along the way. But I want you to just look at these two beautiful quotes to remind yourself on the journey that you're about to take. Next slide, please. You're already facing some challenges as we speak. Worries are already part of your life. COVID is an additional worry you should get ready to handle. We have faced a lot in the past few months already, and we have learned and are still learning a lot. We have a long way to go. We have to help each other and manage these challenges. One way or the another, we will fight this together. There is light at the end of the tunnel. Next slide, please. You probably have some of these questions already on your mind. If you're pregnant, you're probably worried about all of these things. What if I catch COVID-19? Can I transmit COVID-19 to my baby? If so, how could I transmit it? And what do I need to do to reduce the chances? These are all very valid concerns. Next slide, please. So just to give you some background about COVID, starting in December 2019, increasing number of patients were reported to be admitted to hospitals in Wuhan, China, with a pneumonia-like disorder of unknown cause. By the end of January 2020, it was estimated that close to 8,000 cases had been confirmed in China. Similar cases had been identified in numerous countries around the world. The illness, known as coronavirus disease 2019, or COVID-19 for short, is caused by a novel B coronavirus called severe acute respiratory syndrome coronavirus 2, or SARS-CoV-2. The symptoms included fever, dry cough, shortness of breath, weakness, and diarrhea. Many other symptoms have been described recently. As of August 2020, just last month, over 18 million people worldwide have been infected with SARS-CoV-2, and 700,000 infected individuals have died globally. These are staggering numbers. The whole world is united and fighting this unseen enemy. Here are some specific pregnancy-related facts related to COVID. Now, let me just go through them. Pregnant and non-pregnant women have similar types of symptoms. COVID symptoms are common to everyone. There is a large number of asymptomatic COVID-19 positive pregnant patients. So universal testing for COVID-19 is recommended for all pregnant women to prevent spread to other patients as well as to healthcare workers. COVID-19 is highly contagious and can cause serious respiratory illness in moms. Transmission is possible, but I do want to stress that it is rare during pregnancy, delivery, and post-delivery. Next slide, please. Being pregnant puts you at a greater risk for more serious complications from COVID-19. Being pregnant and being overweight or obese may increase the risk a bit further. There may be increased chance of preterm birth. Next slide, please. So vertical transmission, meaning transmission of the virus from mother to baby through blood, placenta, and in the birth canal is known to be likely. So the risk is low. However, we need more studies to prove that. Horizontal transmission, that is person to person transmission, there is more chance of the baby getting the virus from an infected caregiver or parent after birth. Next slide, please. So ideally, every pregnant woman should identify, interview, and pick a pediatrician before the baby is delivered. And there are many reasons for this. You want to establish a relationship early on during pregnancy. The CDC also recommends that all newborn babies born to COVID positive or suspected positive moms should get tested at 24 hours of age and have a repeat test if the initial one is negative. Obviously, until the results are back, caregivers should use the personal protective equipment. Now, all newborn infants who are infected with suspected COVID-19. Now, this does not apply to moms who do not have COVID-19. So I want you to understand that this is just for women who are positive or suspected, then the babies get tested. Next slide, please. Okay, so let's talk about some questions you might have about what happens after the baby is delivered. You probably are quite overwhelmed and want to know, so what happens after the baby is delivered? What tests are required for my baby? When will my baby be checked? When can my baby visit the pediatrician? Let's go through some of those questions. Next slide, please. So all babies get examined after delivery and again before discharge from the hospital. All babies should receive a hepatitis B vaccine and vitamin K shots after delivery. Besides a COVID test, a hearing test and a state-mandated newborn screening blood test will be performed. Tests for jaundice may be required. If baby or mom are COVID positive, quarantine instructions will be given prior to discharge. Now again, it's only for babies whose moms are tested positive for COVID, but all other things applies to everyone, all babies. The hepatitis B, the vitamin K, and the state-mandated newborn screening, all of those things. Next slide, please. So moving on to the breastfeeding concerns. These are some common questions that I get asked all the time. Can I breastfeed my baby if I tested positive for COVID-19? Will I pass the virus through breast milk to my baby? How do I prevent transmission? Again, all of these are very relevant and very valid questions, but I'll tell you there is good news about breastfeeding during the COVID era. Let me go through some of these things about breastfeeding itself. Next slide, please. Breast is best, as we know, with or without pandemic. The risk of transmitting the virus to your baby through breastfeeding is low. So therefore, American Academy of Pediatrics recommends breastfeeding for everyone, even for COVID positive mothers. As always, precautions have to be taken to prevent the transmission of the virus while breastfeeding. We will go through what these precautions are in the next slide, please. So for direct breastfeeding, that is, moms who want to hold their babies and directly breastfeed them, please wash your hands and breast. Wear your face mask and use well-ventilated rooms. For moms who want to feed pumped breast milk, again, proper hand washing technique is absolutely required. Wearing a mask during pumping and thorough washing of hands, breasts, and pumps and bottles. Ideally, of course, pumped breast milk should be fed to the newborn by an uninfected caregiver as recommended by the American Academy of Pediatrics. Next slide, please. So during the lockdown for COVID in the last few months, this first question was on every parent's mind. So much so that a lot of people wanted to do virtual visits. There are no easy and quick answers to this particular question, but I am going to answer it as best as I can, and specifically with regard to my clinic here in Baylor's Cotton White Lakeway. The other two questions are applicable to everyone. When should we visit? What to expect during these visits? Pandemic is just an additional question. Next slide, please. Here at Baylor's Cotton White Clinic in Lakeway, we have strict policies in place to keep our families and staff safe. I am sure all medical offices have guidelines that they follow also. For all practical purposes, your baby's first visit with the pediatrician starts anywhere between 2 to 5 days after birth, or within a few days of discharge from the hospital in case you happen to be there longer. Assuming that you have already picked a pediatrician for your baby, get ready to start making this partnership work for you. You should feel comfortable discussing all issues of your baby with him or her. It is a long term partnership, and if all goes well and it is the right fit, your baby's pediatrician will be with you all along until your child is 18 years old. So, this is a long term relationship. That's why I am stressing the importance of picking a pediatrician, interviewing them, getting to know them, and make sure they fit your family style ahead of time. Next slide, please. So, what happens during the next few visits? If everything looks good on the first visit, your baby's next visit is at 2 weeks of age. Second visit is 2 weeks of age. What will happen? Baby will be examined again. Every visit, the baby will be examined. The second newborn screening blood test will be performed. Additional visits should be scheduled at 2 months, 4 months, 6 months, 9 months, 1 year, 15 months, 18 months, 2 years, 30 months, and 3 years. These are routine preventative care visits that all babies should get scheduled. Then annual visits happen thereafter. Now, many of these visits will include needed immunizations for sure, but more importantly, your child's development, growth, nutrition, mental health, and all aspects of injury prevention will be addressed. There are many things that need to be identified and addressed at various stages in a child's upbringing. Missing those visits means missed opportunity for catching something important. So do not take these preventative care visits lightly. They are very important. Whether there are shots during those visits or not, they're important visits. Next slide, please. So during the pediatric visits, what happens during the pandemic? You will be required to go into the office with your baby for well child visits and follow all safety measures as enforced by the office. You will get your temperature taken. You will be asked to wear a mask, and it is better for you to come prepared with all of your questions that you don't forget during the visit. These are some of the things that you can expect during the visit at the office. Please, I encourage you to try to cooperate and follow whatever safety measures are in place. They are there to protect you and to protect the staff in the office. Next slide, please. Now, as I mentioned before, we are going to move on to something slightly different but still related to the topic, and that is self-care. As always, it is important to have the right perspective in life. You are only as good as how you care for yourself. At least that is my honest opinion. You are important. If you take care of yourself, you will be an excellent caretaker for your family. Do not think that you can sacrifice your well being, to care for others. As a pediatrician, it is very important for me to know that parents are in good health, not only in body, but mind and spirit as well. Only then I know that your baby will be well cared for. Now, more than ever, we are all spending a lot of time at home. I will talk about how to create a healing space for you, yourself, and for your family at home. Next slide, please. Here are some points to consider to take better care of yourself. I will touch upon each one briefly in the next few slides. I will break it down as what you see, what you hear, what you touch, what you smell and breathe, and what you eat. This applies not just during pregnancy, but at practical points for everyone. Next slide, please. Surround yourself with calming and beautiful natural views. Beautiful views of nature are calming. Bring in sunlight. Sunlight will enhance your mood. Some of the small examples that I can give you for beautiful natural views are as simple as a potted plant, flowers in a vase, a beautiful picture of outdoors on the wall. You can simply open a window and bring in natural sunlight every day. I don't know about you, but clutter in the home can be stressful for me. So try to declutter your home to reduce your stress. So now is probably a good time to do that, to get rid of your stuff that you don't need. Before the arrival of your baby might be a good time to clean up your surrounding. Next slide, please. Take time to listen to the sounds of nature. Loud noises are stressful, while quiet nature sounds are calming. If you're nowhere near nature sounds, look for nature soundtracks on the internet. Ocean waves, rippling brooks, rain, birds, wind in the trees. These are all very calming for the mind. Close your eyes, even if it is for 1 minute, and focus on your breathing. Meditate for a few minutes if you can to refocus your mind. Don't feel obligated to respond to every message that comes your way. Be picky about what you want to answer. Do not let any messages or comments come in the way of your inner peace. Think before you react and analyze if it is worth your attention. In my opinion, most of them do not need any reaction. Just let it go. Next slide, please. Pamper yourself with warm shower. Wear cozy clothes that make you feel special. When you're ready to for bed, snuggle in a soft comforter if you want. For you, not for the baby. Or put a pair of fuzzy socks. Warmth will help you fall asleep better. When the baby, guard your sleep time because your sleep is very important now and after the baby comes. And your sleep area should be comfortable. Make this space very comfortable for yourself. When the baby is here, you have to adjust your sleep around your baby's schedule. Sleep when the baby sleeps and delegate work to get some help in those critical first few weeks of life after the birth of your baby. Now, I have highlighted this last point in red for obvious reasons. I cannot stress this more. It is critical for new parents to understand the dangers of putting the newborn baby in their bed. These dangers are very real, and the precautions would apply anywhere and at any time. Risk of injury, suffocation, and death are easily preventable by keeping the baby out of your grown up bed. Please take this seriously. Next slide. Next slide. Think of smells that remind you of happy times and recreate them at home. Bake an apple pie or chocolate chip cookies. Keep good ventilation in your house. Natural fragrances should be used as much as possible. Chemical fragrances can irritate your throat and also your baby's throat. If you're cooped up in a closed space, especially with many people, the carbon dioxide that you breathe out can accumulate, making you sleepy and impairing your ability to think clearly. Fresh air is good for preventing infections. If you're a smoker or have a family member that smokes, rethink. This may be the time to quit. Next slide, please. Prepare wholesome, nutritious meals for yourself. Meal prep and freeze meals for those important first few weeks of childbirth. Now, this does not seem like much now, but believe me, when you go home from the hospital and you're sleep deprived, the last thing you want to do is to get up and cook. You might think, oh, well, we'll just order takeout or delivery. Although this option sounds okay at first, it may not be the best choice, at least in my opinion. The last thing you want to do is to catch something, a stomach bug, or by eating some unhealthy fast food. Your diet may affect your baby if you're breastfeeding, so use caution. Stay away from processed foods, stay away from any type of drugs, refrain from drinking alcohol or smoking while breastfeeding. Your body needs plenty of rest, so please do take care of yourself. Next slide, please. So, my final thoughts are bringing a new baby into this world is a life changing experience for a parent, especially the mother. I urge family members, and if family members are listening, this is for you, please. Partners and spouses, everyone, be understanding of the new mom's problems and be compassionate towards her. Allow her plenty of rest. The added burden of the pandemic makes this phase of life challenging and at times frustrating. Don't let the difficult times that we are faced with take away the pleasure children bring to our lives. A birth of the baby is nature's way of saying life goes on and life should go on. Next slide. I think we have come to the end of my presentation. Thank you all for your attention. I hope this information is useful for you. If you have any further questions or would like to make an appointment to meet me in person, my contact information is up on the slide. Enjoy the rest of the Blue Minute, and I can take some question. I don't know if the time permits. Thank you, Allison, for your help. I appreciate it.
Yeah, there actually was a question. Someone had asked if you recommend a flu shot for a 7-month-old.
Yes, 7-month-olds, after 6 months, anyone can get a flu shot.
Great. I don't see any other questions, but this is the end of Dr. Adeni's webinar. So if you'd like to drop those comments into the chat feature, we'll give you about 15 to 20 seconds to do that. Dr. Adeni, thank you so much. You always do such an amazing job. And as I mentioned, as our pediatrician, our family's doctor, thank you for taking care of them with such care. You always dot your I's and cross your T's when it comes to the care that you give our kids. And so we just really appreciate you dropping all of this information on us, especially these new moms as they enter this new journey of motherhood.
Thank you. Thank you, everyone. Bye. Have a great day.
Yes, you have a good day as well. See you soon. Next up is ATX Nails. When we hit end webinar, it should launch you over there, but we are also putting those links on the Facebook event as well. So if you get lost, you can just go back to that main landing page. All right. Thank you so much. Bye-bye.